I'm at least 18 years of age and I consent to being in this video.
Okay, to start off, I'm going to apply hand hygiene. And then I'll be going to the Pyxis to grab medication for the patient today. So the two medications I'm going to be giving the patient today is Digoxin, 125 micrograms, tablet PO daily. And we're also giving a Humulin subcutaneous insulin injection. The client's glucose level was 256. So on the sliding scale, we will be giving 3 units. So first, I will be getting the Digoxin out of the Pyxis, making sure it's the right medication, the right dose, and the right route. So I'm going to take a medication cup and drop that Digoxin in there ready for the patient. Next, I'll be drawing up the insulin for the patient. So we'll need a syringe, a needle, an alcohol swab, and then the insulin. So first, I'll be taking the alcohol swab. I'll be scrubbing the hub of the insulin for 15 seconds. Then I'll be drawing up some air in the syringe, 3 units, poking that needle in, and injecting the air into the insulin. I'll then flip it over and draw out 3 units of the insulin. After this is done, before I go to the patient's room, I am going to check with another nurse the insulin dosage and the route and all of that. Okay, so we're ready to go to the patient's room. Hello, can you please state your name and date of birth?
Hello, I'm Brendan and I was born on 2/3/98.
Okay, and then do you have any known allergies?
No.
Okay, so the first medication, or 2 medications for you, I have Digoxin and then I have insulin. That's going to be an injection into your abdomen. The first one I'm going to give you is Digoxin. It's going to be orally, but first I'm going to check your apical heart rate to make sure it's not under 60 or I cannot give you this medication. Okay, and after 1 full minute, the patient's heart rate was 105. So I'll be giving this to the patient with some water. Here you go. Make sure he takes it. I'll take the medicine cup. And then for the insulin, we are going to get the syringe and alcohol. We're going to do it on your abdomen, 1 inch away from your umbilicus, which is your belly button. I'm going to have you draw up your shirt. We're going to scrub the area where we're going to do the injection. I'm going to pinch the skin and inject the insulin. All right, you can put your shirt down. So for the Digoxin I gave you, we want you to look out for adverse reactions such as vision changes, nausea, vomiting, confusion. And we're also going to monitor your vital signs throughout taking this medication because it can cause your heart rate to lower. And for insulin, we always want you to report any adverse effects relating to like low blood sugar, such as like paleness, shakiness, sweating, and anxiety. So that is it for you today. Do you need anything right now? I'll be checking on you periodically, but if you need anything, just use your call light.